Welcome to the Deep Dive, where we take complex information, sometimes a big stack of it, and unpack what you really need to know. Today, we are diving deep into a topic that feels incredibly relevant right now: the potential for cannabinoids in relieving pain. With increasing access in many places, this is definitely on a lot of minds. The core of our deep dive today is a systematic review published in PLOS ONE in early 2023. Now, this isn't just a single study. Think of it as researchers taking dozens of individual randomized clinical trials, pulling all that data together, and trying to get the clearest, most comprehensive picture possible.
That's exactly right. The mission of this particular systematic review and meta-analysis was to rigorously assess both the potential benefits and the potential harms of using cannabinoids for any type of pain. They weren't just looking for whether pain scores went down, they also specifically looked at other crucial factors like quality of life, sleep, potential dependence, psychosis, and critically adverse event side effects, both serious and non-serious. And they specifically compared cannabinoids against a placebo to really try and isolate the effect.
Okay, so they cast a pretty wide net then to capture all the relevant research. What did that net actually pull in? What kind of studies, what kind of participants were included in this massive review?
So the researchers searched multiple major databases, looking for published and even unpublished randomized clinical trials. The key was they had to compare any type of cannabinoid intervention to a placebo in adults experiencing any kind of pain. They ultimately included 65 trials in their analysis, involving over 7,000 participants.
Wow, 7,000 people.
Yeah, quite a lot. And the types of pain varied quite a bit, which is important. The largest category was chronic pain, covering conditions like neuropathic pain or chronic back pain. They also included studies specifically focused on cancer pain and trials looking at acute pain, like pain after surgery. A couple of trials even looked at fibromyalgia pain.
Okay.
And the duration participants were followed in these studies also varied, quite a lot actually, from just a few hours for some acute pain trials up to 16 weeks for some of the chronic pain studies.
Got it. A really diverse group of studies covering different pain types, different durations. Now, before we get into the findings, did the authors say anything about the quality of these studies they were pooling? Because, combining results from studies that aren't well designed can really muddy the waters, right?
You've absolutely hit on what is perhaps the single most important point the authors emphasize throughout the paper. It's crucial. They formally assessed the risk of bias in each of the 65 included trials. And the finding is, well, frankly, it's quite concerning.
Right.
The vast majority, a staggering 59 out of the 65 included trials, were assessed as being at high risk of bias.
Wow. 59 out of 65. That feels incredibly high.
Yeah.
What exactly does high risk of bias mean in this context? Does it mean the results are just not trustworthy?
Well, it means there are significant flaws identified in the study design or maybe the reporting that make the results less reliable. It could be things like issues with how participants were randomized or whether the blinding, making sure people didn't know if they got the real treatment or the placebo was effective, or maybe incomplete reporting of results or other methodological weaknesses, things that make you question the numbers a bit. And the authors are very clear about this. They state that this high risk of bias means there's a substantial risk that the findings from these studies, when you pull them together, might actually overestimate any potential beneficial effects and at the same time underestimate any potential harmful effects of cannabinoids. So we really have to view all the findings from this review through that lens of significant uncertainty about the underlying data quality.
That context is absolutely critical. It sounds like even before we hear the results, we need to understand they're based on a foundation of, well, pretty shaky evidence according to this review's assessment. Okay, so with that huge caveat firmly in mind, let's dive into what they actually found when they pooled the data. What was the picture for pain relief itself, broken down by those different types of pain?
Right, and they had to analyze the pain types separately because, well, the effects appeared to differ. Let's start with acute pain, think like post-operative pain.
No.
When they pooled the data for that, the meta-analysis showed no evidence of a difference in pain levels between participants receiving cannabinoids and those on placebo.
No difference at all.
Well, the effect size was actually slightly higher pain in the cannabinoid group, believe it or not, though it wasn't statistically significant. And the certainty of this evidence was assessed as very low, largely because of that pervasive risk of bias we just talked about.
Okay, so no clear benefit for acute pain shown in this review. What about cancer pain? That feels like another area where these treatments are often considered.
Yeah, similar story there, unfortunately. For cancer pain, the meta-analysis also showed no evidence of a difference compared to placebo. What's notable here is they actually felt they had enough statistical power in their analysis to confidently reject the idea that cannabinoids provided a significant reduction in cancer pain based on this specific data set anyway.
Okay, wow. So that's pretty definitive for acute and cancer pain within the scope of this review. No clear benefit shown there.
Hmm.
Now, let's talk about chronic pain. That's probably the most common reason people are exploring cannabinoids for pain management, right?
Yeah.
What did the review find there?
Right. This is where they did find a statistically significant effect. So when pooling the chronic pain trials, cannabinoids did appear to reduce pain levels compared to placebo. The mean difference on a standard 0 to 10 numerical rating scale for pain, where 0 is in no pain and 10 is the worst imaginable, was next to 0.43, favoring the cannabinoid group. And this result did meet their threshold for statistical significance.
Okay, a reduction, and it's statistically significant. That sounds promising, first glance. But you mentioned statistical significance earlier. Does a reduction of, what was it, 0.43 points on a 10-point scale
Right.
actually feel like a big difference to someone who's living with chronic pain?
This is precisely where the authors make a critical distinction, and it's really a core takeaway from this entire paper. While the result was statistically significant, meaning it's unlikely to, just due to random chance, the magnitude of that effect size, that 90.43 points, was below their predefined minimal important difference, or ME.
Minimal important difference. Okay, what does that mean exactly?
Think of the ME as the smallest change in a score, whether it's pain or sleep or something else that a patient would genuinely notice and consider beneficial, like in their actual daily life. It's the threshold for, does this actually matter to me?
Got it.
For chronic pain measured on that 0-10 scale, the commonly accepted MAD, and the one the authors predefined for their analysis is 1 point.
I see. So the numbers moved enough to be statistically different from placebo in the analysis, but they didn't move enough to cross that 1-point threshold that researchers, and more importantly, patients, generally consider a meaningful or clinically important improvement.
Exactly that. It's the difference between detecting a signal in the data, which they did, and that signal being strong enough to really matter in terms of a person's actual experience of their pain day to day. A drop from, say, a 7 out of 10 pain score to a 6.57 might be statistically detectable if you look across thousands of participants, but it's pretty unlikely that a single patient would perceive that small change as a significant benefit worth potential side effects.
That clarifies things significantly. Okay, so statistically significant for chronic pain, but likely not reaching that bar of clinical importance. What about those other outcomes you mentioned they looked at, beyond just pain levels, like quality of life? Did that improve?
Yeah, they looked at quality of life. The meta-analysis there was based on only 4 trials, so not a lot of data. But based on those, it found no evidence of a difference between the cannabinoid group and the placebo group. And again, the certainty of this evidence was rated as very low, and there was high heterogeneity, meaning the results kind of varied a lot between those few studies. So really, we can't draw strong conclusions about quality of life from this review.
Okay, so no clear signal there either. How about sleep? Because pain notoriously disrupts sleep, right?
Yes, and this is another area where they found a positive, statistically significant effect. Cannabinoids did improve quality of sleep compared to placebo, according to their meta-analysis. The result was statistically significant. The p-value was quite low.
Okay, an improvement in sleep. And did that improvement cross the threshold for clinical importance, like you discussed with the chronic pain finding?
Again, no. Similar to the chronic pain finding, the effect size they found for sleep quality, while statistically significant, was below their predefined minimal important difference for sleep outcomes.
Huh. So, same pattern.
Pretty much. A statistically detectable improvement, but its clinical relevance, whether it would truly feel like a meaningful improvement in sleep quality to an actual patient, remains uncertain based on this data and their criteria.
So we're seeing this pattern. Statistically significant, but likely not clinically important effects for both chronic pain and sleep. Okay, what about the more serious outcomes they tracked? Things like mortality or serious adverse events.
Right. For all-cause mortality, based on 7 trials, there was no evidence of a statistically significant difference between the groups. For serious adverse events, or SAEs, that was based on 18 trials, and there was also no statistically significant difference compared to placebo found. However, and this is really important, the p-value for SAEs was close to the conventional significance threshold.
Close.
Meaning it was sort of borderline. And crucially, we have to remember that point we made about the high risk of bias. The authors explicitly caution that a non-significant difference here doesn't automatically mean there's no increased risk of serious events. Especially given the flaws in the underlying studies, their analysis actually showed indications of a potentially harmful effect regarding serious adverse events, even if it didn't cross that arbitrary line of statistical significance.
Right. So we definitely can't rule out an increased risk of serious problems based on this review.
Exactly. Non-significant doesn't equal proven safe, especially when the data itself is considered shaky.
That's a really critical point.
Eh.
Okay, what about the less serious side effects, the non-serious adverse events, which might be more common day to day?
This is another key finding, and here the result was actually quite clear and statistically robust. Cannabinoids did increase the risk of non-serious adverse events compared to placebo. The risk ratio was calculated at 1.20.
A risk ratio of 1.20. How do we translate that into something, easy to grasp? What does that mean practically?
It means that participants receiving cannabinoids were 20% more likely to experience one or more non-serious adverse events compared to those who received the placebo. And the authors helpfully calculated something called the number needed to harm, or NNH, specifically for these non-serious adverse events.
The NNH.
Right.
Remind us what that tells us again.
The NNH is a very practical number. It essentially tells you how many people you would need to treat with the intervention cannabinoids in this case instead of the comparator, which was placebo.
Okay.
For one additional person to experience the specific negative outcome here, a non-serious adverse event who wouldn't have experienced it if they had gotten the placebo instead.
Got it. So for every X people treated with cannabinoids, one extra person gets a non-serious side effect they wouldn't have otherwise gotten. What was the NNH here?
The NNH for non-serious adverse events was 7.
7.
7. So for every 7 people treated with cannabinoids for pain in these trials, on average, one additional person experienced a non-serious side effect compared to if they had received placebo.
An NNH of 7 for non-serious events.
Wow, that feels quite low. I mean, that suggests a pretty common occurrence, right?
It does suggest they're relatively common, yes.
Did they specify which kinds of non-serious side effects were more common?
They did, yes. They broke down the specific events that occurred more frequently in the cannabinoid group. The most common ones reported were things like dizziness, fatigue, vertigo, nervous system disorders more broadly, and also gastrointestinal disorders, stomach issues, things like that.
Yeah, things that, while maybe not classified as serious in a clinical trial, can certainly impact your daily life and your quality of life, even if the overall quality of life score wasn't statistically different in the end.
Absolutely. Feeling constantly dizzy or fatigued isn't exactly a minor thing for most people trying to function day to day.
Definitely not. And what about those other potential long-term concerns that were on their initial list of outcomes, like dependence or psychosis? Yeah, that's a good question. The review notes that, unfortunately, none of the 65 included trials actually reported results on cannabinoid dependence or psychosis in a way that allowed them to be included in their meta-analysis.
Oh, so no data on that from this big review.
Essentially, no usable data that could be pooled. So based only on the data they were able to synthesize from these specific trials, this review cannot really speak to the potential risks of dependence or psychosis associated with using cannabinoids for pain. That evidence base is either still missing or just wasn't reported adequately in the trials they included here.
That's another important gap to be aware of then. Okay, so let's try and bring all these different findings together. We've got statistically significant, but likely not clinically important effects for chronic pain and sleep.
Right.
A lack of evidence for benefit in acute or cancer pain.
Correct.
A potential signal for serious adverse events that we can't ignore because of the bias. And a clear, statistically robust increase in non-serious adverse events with an NNH of just 7. Given all that, what is the overall conclusion the authors of this big systematic review actually draw? What's the bottom line?
Well, their overall conclusion, and they state it quite directly in the paper, is that based on the evidence compiled and analyzed in this review, the harmful effects of cannabinoids used for pain seem to outweigh the potential benefit.
Wow. Harm seem to outweigh benefits. That's a pretty strong statement, isn't it? Especially considering how much sort of buzz and enthusiasm there is around medical cannabinoids for pain right now.
Yeah.
And I imagine they're framing this conclusion very heavily through that lens of the high risk of bias they found in most of the underlying studies.
Oh, absolutely. They keep coming back to that point, and rightly so. Because 59 out of the 65 trials had that high risk of bias, they reiterate that their pooled results likely overestimate any benefits and probably underestimate the harms. So that conclusion that the harms seem to outweigh the benefits is made even more likely, or at least more concerning, when you factor in the questionable quality of the underlying evidence itself. They also position their review relative to some prior research. They note that their findings, particularly the lack of clinically important benefit, differ from some earlier reviews that might have suggested a more adequate analgesic effect.
Why the difference?
They attribute this difference partly to their more comprehensive search strategy, but also critically to their rigorous methodology, particularly their formal assessment of bias across all studies and their focus on using those predefined minimal important differences to judge clinical relevance, not just statistical significance.
And you mentioned earlier that their findings seem to align more closely with the stance of some major pain organizations.
Yes, exactly. They note that their findings seem to support the position of organizations like the International Association for the Study of Pain, the IASP. The IASP has generally expressed caution about the widespread use of cannabis and cannabinoids for pain, primarily citing the lack of consistent high-quality evidence demonstrating clinically significant effectiveness and an acceptable safety profile. This review kind of reinforces that perspective.
So given the real-world context, the increasing availability and even medical recommendations for cannabinoids for pain in many countries and states, how do the authors connect their findings to that situation?
They address it head-on right in their conclusion. They explicitly state that according to their results from this comprehensive review, the expanded medical use of cannabinoids for pain is, and I quote, "at this point, questionable."
Questionable. Again, pretty direct language for a scientific paper.
Very direct. They are essentially saying that the current evidence base, when you analyze it rigorously like this, doesn't really provide strong support for the widespread medical use for pain that we're seeing, particularly when you carefully consider the balance of risk versus benefit as they assessed it here.
Wow. Okay, that was a truly deep dive into what this major systematic review found. It really lays bare the current state of the evidence, doesn't it?
Yeah.
Highlighting that while there might be these statistically detectable effects for chronic pain and sleep, their actual size is likely too small to be clinically meaningful to a patient. And then on the flip side, there's this clear increase in those non-serious but still bothersome side effects like dizziness and fatigue happening in roughly 1 out of every 7 people treated compared to placebo.
And all of that, as we stressed, is filtered through that critical finding that the vast majority of the underlying studies themselves are considered to be at higher risk of bias, which just means we should be even more cautious about interpreting any potential benefits and perhaps more concerned about underestimating potential harms. It's definitely a complex picture, not the simple cannabinoids help pain narrative you often hear out there.
No, definitely not. And this is such a perfect illustration of why doing a deep dive like this, going straight to the source material, understanding not just the headline findings, but also the quality of the evidence and the crucial nuances, like clinical versus statistical significance, why that's so essential. It gives you a much, much more accurate picture.
Absolutely. Relying solely on headlines or maybe anecdotal reports just doesn't capture the full story, especially when the evidence base itself has such significant limitations, as highlighted really clearly in this rigorous review.
So what does all this mean for you listening in? Well, it means that despite the growing accessibility and, let's face it, the buzz around cannabinoids for pain relief, the most comprehensive scientific analysis of the clinical trial data we have to date suggests the benefits for chronic pain and sleep are likely small and, frankly, of questionable clinical importance. Meanwhile, the risk of bothersome side effects, things like dizziness, fatigue, feeling off, is clearly increased. And, maybe most importantly, the quality of the studies supporting even these modest findings is largely considered poor. So, here's a provocative thought for you to chew on as we wrap up. Considering this comprehensive review's strong conclusion that the harms seem to outweigh the benefits, and the author's explicit questioning of the expanded medical use for pain, how should healthcare providers, policymakers, and maybe even you navigate the tension between this scientific assessment and the undeniable widespread demand and availability of cannabinoids? What is the most responsible way to communicate the known, potentially small benefits, the clear increase in certain harms, and the significant limitations of the current evidence to individuals who are genuinely seeking relief from pain? Keep thinking, keep learning,